have here, does smoking increase the risk of acute myeloid leukemia?
I think there are some suggestions, speculations that smoking is related or can increase the risk of developing acute myeloid leukemia. Regardless, smoking is bad for many other reasons too. So I encourage all of my patients to quit if possible.
Yeah, it's never too late to quit. Well, in most cases, and anytime you're getting active therapies and you're smoking still, it could just make things harder. So yeah, there is I believe an association with AML. My grandfather had multiple myeloma. My grandfather had multiple myeloma. Do I have an increased risk of that? And what about my own children?
I think that's a loaded question. There are many factors that, lead to the evolution of myeloma. There have been associations and studies of genome-wide association studies that looked into whether there are like inherited genes that can be linked to myeloma. These studies, large studies, are ongoing. What we know for a fact is that there are some clusterings of genes that do predispose to having a higher risk, and that risk is estimated to be 2 to 3 times than the general population. But then, confirmatory studies are pending. There's also like a racial disparity seen. If your race happens to be of African American origin, you are at a higher risk. That being said, I think it's a discussion to have with your your grandfather's oncologist and seek genetic counseling if may.
Yeah, I think, as you said, there's clearly a 2 to 3-fold higher risk in the first degree relatives. So clearly, and that seems to be partly genetic and partly environmental driven. But clearly, both the racial makeup also increases the risk. And of course, if you have more than one family member, then your risk also goes up. Again, suggesting that there's probably some kind of a genetic factor that is driving it. But we still wouldn't do anything. We definitely not recommend screening in everybody, just because the fact that, as I said in the beginning, this is a very uncommon condition compared to a lot of other cancers. And even with the 2 to 3-fold higher risk, you're still looking at very low risk in the absolute terms. So, widespread screening is not something we would recommend at this time.